Today we're going to talk about whether you can reverse osteoporosis or osteopenia with lifestyle interventions, or do you always need medications, or are medications even helpful? So if you're new to my channel, please feel free to subscribe and click the little alert button. I'm happy to go live most days of the week. Sometimes I can't, but most of the time I'm here trying to teach some educational concept or around lifestyle, decreasing medications and such. My name is Dr. Lori Marbus. I'm a board-certified family and lifestyle medicine physician, and have been helping people really try to reach their best selves for a couple of decades now. So thank you for watching, and let's jump right into our topic, which is osteoporosis. Many of my patients, I am, by the way, licensed in all 50 states, and also DC. So I've seen patients from across the country, in every state actually. And so you'll see a variety of consistent questions, right? Like dealing with osteoporosis or high cholesterol, hypertension, struggling to lose weight, menopause, things like that. But osteopenia and osteoporosis is a common thread amongst my patients. So I thought I would highlight some of the things I've done in a recent workshop, and love to create ebooks and workshops. So I run a thing called the Healing Kitchen with my good friend Brittany Giroudi, and we cook and meet weekly live, and I do workshops every single month. You should check it out at drmarbus.com if you're also interested in that. Also, please join the newsletter. I send out a weekly newsletter with topics like this, and a whole food plant-based recipe every single week. So let's dive right in. But with this workshop, I really wanted to speak to what does the evidence show, and what can you do really? So I think number one, let's kind of just walk through it logically. First of all, we have to identify what is actually causing it. Right? So I think that's a conversation sometimes that is missed or not even done with regular doctors. We go straight to treatment, sign a prescription, go get this done, and get them out of the office type thing. But let's talk a little bit about the 12 different ways we should be avoiding things that are worsening our bone health. Let's start there. Number one is, of course, is age-related bone loss, which just kind of occurs naturally with age. So there's that piece. Well, there's not much we can do about that. There could be hormonal imbalances, especially reduced estrogen as we hit perimenopause, menopause, and low testosterone in men. I had one patient who was in his, I believe, early to mid-50s, and they found he had osteoporosis when he went to lift a heavy load, and he actually had a compression fracture in his vertebrae. Come to find out that he had low testosterone, right? So that led to low bone density in men. That's the number one cause. Next is some genetic factors. There are some family history of osteoporosis. We're not going to go into that deep wise because, again, we're looking for interventions. Another one is nutritional deficiencies, right? So we'll talk about a few of the things that we want to pay attention to, but of course, things that you've heard of is calcium and vitamin D, but I would also suggest protein is a very important one, and we'll get to some more of the more specific ones here in a moment when we look to making sure you're eating the right foods and consuming enough of them. Another one is lack of physical activity. Sedentary lifestyle leads to weaker bones, right? So remember, bones are living organs, and they respond to dynamic forces, especially these forces that are, you can imagine driving down, like through the spine and through the hips, like walking, jumping, running, or resistance training, putting weight and the load. The body responds to stresses. So that's number one. What number is that? 5. Next is excessive alcohol consumption. That can interfere with your calcium absorption and bone formation. I'm not a fan of alcohol in any amount. So if you can, and you should, avoid alcohol at all costs, because alcohol is in and of itself a toxin. It's not good for your liver. It's not good for your lipids. It's not good for your heart. It's not good for anything. So consuming alcohol is, again, if you're looking to get healthy, consuming alcohol takes 2 steps back. So there you go. Next is smoking. I think at this point in 2024, we've had probably the lowest rates of smokers in at least the United States. But if you are still smoking, I would encourage you to stop for obvious reasons. Next is chronic use of certain medications like corticosteroids, like prednisone. If you have a lung condition, that can do it. Certain anticonvulsants and certain cancer treatments can cause an increased risk of osteoporosis. Again, sometimes you can't do anything about that. You require those medications, but just so that you're aware, if you are taking those medications, you absolutely should be looked at on a regular basis with your bone density. And then some medical conditions like hyperthyroidism, right? If you're taking too much thyroid medication or you actually have hyperthyroidism, that can be an issue. Rheumatoid arthritis, celiac disease, and certain eating disorders. There are different reasons why that you would be getting osteoporosis because of these, but with the eating disorders and celiac, it's going to be lack of absorption of certain components that are important for your bone health. So pay attention to that. Another one is chronic kidney disease because it can affect your calcium and phosphate balance. Any gastrointestinal surgery, right, can also affect nutrient absorption. So, for example, if you've had gastric bypass or some type of weight loss surgery, that needs to be taken into consideration. And you really want to stay on top of your bone density, especially as you age. And the last one is excessive caffeine intake, right? So that may interfere with your calcium absorption. So what are the labs that you should be doing or test? First of all, is a bone mineral density test, right? The DEXA scan, that can just basically assess the density and the quality of your bone, right? So that you'd want to do probably about every 2 years or so. You could also do CBC, right, to rule out any blood disorders. That's a complete blood count. You want to do your serum calcium and phosphate, again, to look at your metabolism of those. And then vitamin D, of course, especially if you live in higher latitudes and you're not outside, or if you have darker skin, more melanin will protect you from sun, but it also decreases your vitamin D production in your own skin. Next is thyroid test, right? So because that will also test, one, let's say that you have hypothyroidism and you're taking medication, you don't want to take too much medication. And the other piece is to look for hyperthyroidism. So maybe you're utilizing your own thyroid is too active. There's another one called parathyroid level, or PTH. These are two little glands that sit on the thyroid, and the little butterfly thyroid, little tiny things, but they're really, really important for your calcium regulation. So you want to pay attention to that. Should be part of every osteoporosis workup. And of course, men, we talked about earlier, was testosterone, estradiol in women, especially if there's in some consideration that maybe you're not entering into menopause, but maybe that perimenopause region, that might be a discussion you need to have with your doctor. There's some other things to look for, more rare causes of osteoporosis, like a serum protein electrophoresis. There's a thing called multiple myeloma that can be a problem with your bone health as well. Of course, kidney function tests, liver function tests, all can impact nutrient metabolism. And then your serum cortisol to see if there's such thing as called Cushing syndrome. So again, celiac disease and rheumatoid factor, especially if you have some joint discomfort or celiac disease, if you notice GI issues, even rash can come with celiac disease. Again, I can go into deeper dives in each of those, honestly, for an hour. But I just wanted to list with you, something may be ringing true for you. If so, please, ask your doctor and check it out. So let's dive into some of the things that I would want you to pay attention to as far as micronutrients and macronutrients and how much. And then we'll talk about some of those foods and what they look like. And then I'll talk about like kind of a reversal template that you should be looking at. So first of all, let's jump on calcium. You want to be anywhere between 1,000 and 1,200 milligrams daily. You can absolutely do this on a whole food plant-based diet. You just need to be paying attention to the foods. There's a thing called Chronometer, which I love. They have a little osteoporosis segment that you can click on and put in all your food for maybe a week or two and see how much of each of the certain micronutrients that are important for your bone health, and it'll tell you how much you are potentially lacking. So calcium, 1,000 to 1,200 milligrams daily. And what would that look like? So that would be like maybe a fortified plant milk. You're thinking like soy, almond. That would give you anywhere between 300 and 450 milligrams. There's fortified orange juice, tofu prepared with calcium sulfate. That can get anywhere from 200 to 400 milligrams per half cup. You can do collard greens. 1 cup cooked is 266 milligrams. Broccoli cooked, 1 cup is 60 milligrams. So you can see over the course of a day, you can get quite a bit of calcium in your plant-based foods. Next is vitamin D. There are 3 supplements that I'm typically recommending for individuals. B12, of course, is absolutely, as people know, is non-negotiable in my book as far as plant-based eaters. But vitamin D is another one if you test low. So when you test your blood, you want to be hitting at least 30. But I would say there's a sweet spot. I'd say between 40 and 60 is probably where you want to hang out. Vitamin D is important for a lot of other things beyond just your bone health, but like your immune system, mental health, and some other things. But anyway, vitamin D, most people will get to that level taking anywhere between 600 and 2,000 international units daily. Again, if you have darker skin or you live in higher latitudes, that may be important. Some of my patients only need to take it during the winter months, so that might be you as well. So sometimes insurance won't pay for this, but if you have the diagnosis of osteoporosis or osteopenia, they should be able to check your vitamin D and have insurance cover it. So what does that look like? Again, those fortified plant milks, and I'm a big fan of soy because of the phytoestrogens, which also help bone health. But most of the time, like I said, they need supplements. On occasion, mushrooms that have been exposed to sunlight can have some vitamin D, but most of the time you're either going to do supplements, fortified plant milks or cereals, or you're being out in the sun probably 10 to 15 minutes. But again, wintertime, darker skin. I actually take 2,000 international units daily. I was in Florida running probably an hour plus a day, did not have sunscreen on, and I still could not hit above 30. So I'm just not a good vitamin D maker, so I supplement. Next is phosphorus, right? So this is recommended daily intakes around 700 milligrams. Most people are fine on this. For example, you could do lentils. 1 cup cooked is like 355. Peanut butter, 2 tablespoons, 147. Brown rice, 1 cup cooked is 150. Shouldn't take much to do the phosphorus. But again, kidney disease and some other things like that might be something to pay attention to. Also magnesium, right? So magnesium, again, many times you can get plenty. You want 310 to 420 milligrams. Black beans cooked, 120 milligrams. Spinach cooked, 1 cup is 157. Quinoa has 118 with 1 cup cooked. So again, lots of different ways you do this. Vitamin K, and I'm talking about K1 here, but you also need K2, but your gut microbiome will convert, and that will be good there. But vitamin K, you're going to get in any of your dark green leafies, Brussels sprouts, spinach, kale. Most of the time, people get plenty of vitamin K. Next is zinc. I think there's some indication some folks may struggle with certain types of zinc because they're not eating quite enough. I am a big fan of using pumpkin seeds. You only need about 8 or 11 milligrams, but don't be afraid to eat your nuts and seeds, right? Because these are great sources of protein, also those micronutrients like zinc. So I would encourage you you only need maybe an ounce of pumpkin seeds. You get 2.2 milligrams. Lentils cup cooked is 3. Check that out. Zinc. I'm not a fan of supplementing with zinc because when you supplement too much zinc, you can decrease your copper absorption and get yourself into trouble. Most of the time, you don't need to supplement, but there's just a few minor things, like I mentioned. The B12 and vitamin D are the important ones here. Next is vitamin A. Again, sweet potatoes, carrots, spinach, you need around 700 to 900. Again, most people are going to get plenty in their diet. Vitamin C, again, you eat plants, you're going to get plenty. You only need 75 to 90 milligrams per day. 1 orange has 70. There you go, guys. Protein. So really important here is that, like I've mentioned before, yes, you will get plenty of protein on a plant-based diet. However, when you are a smaller framed woman, sometimes they eat so many other very, what should I say, restrictive diet. Like maybe they think, oh, I need to eat a pound of greens a day. Well, now they don't have an appetite for other things. And so we're missing out on those legumes and whole grains, which really hold the protein for us. So you want to aim for 1 to 1.4 grams of protein per kilogram of body weight. If you're overweight looking to lose weight, ideal body weight then. So tofu, huge fan of soy products, like I mentioned. Half a cup, 10 grams of protein. Lentils, quinoa, chickpeas, all those legumes, all those things are amazing. But you can figure out how much you need yourself. Potassium, you'll get plenty of this. Sweet potatoes, avocados, spinach, lentils. I'm hearing lentils a lot, guys. So maybe you should check out the lentils. Lentils are easy to cook. They only take like 20 minutes. You don't have to soak them. They're cheap. Amazing. Another one that's very interested, there's no established recommended daily intake, but it's boron. The boron is important. Something, again, getting back to the nuts and seeds, you're going to find it in almonds, but you can also find it in some other foods, like dried apricots will give you plenty, peanut butter, apples. Apples and peanut butter, yum. And a few other things are going to be manganese, copper, silicone, and again, interesting, there's some interesting research on 1 to 4 cups of tea per day. Who knew? So I drink tea every single day. I had my bone density checked last year. It's fine. Again, but I'm an exerciser doing that stuff. But I just wanted to point out, even someone who's, I think I was 52 then, I'm 53 now, through perimenopause, going into menopause, bone density is great, eating plants for well over a decade, pushing 13 years. It's not the cause of osteoporosis. We really should be having this conversation in our youth for our kids, because that bone density bank stops around age 30 and you have that steady, slow decline. But if you are entering into your 40s or pushing towards perimenopause, please get your bone density checked, because this literally could be I don't want you to say, oh my gosh, I fell, I broke my hip, I'm 70 and I have osteoporosis. Now we're at a place that's really hard to make a difference. But if you're in your early 40s and you're perimenopausal or something like, please get your bone density checked, so we can do something early on. Early intervention is better than late. So please check it out. So what does my reversal plan look like? Well, we talked about find out the cause, fix the cause, right? Talked about the foods and different things. And I think, we talked about the different blood tests and stuff. So let's talk a little bit about now as far as like your dietary plan. So let's just walk through what a breakfast, lunch, and dinner and snacks look like. So maybe we have some fortified oatmeal with sliced strawberries and almond milk or soy milk, lentil soup, a side of kale salad. Maybe we have a portobello mushrooms and quinoa and steamed asparagus and carrot sticks and hummus, right? So now we're hitting all those amazing foods like the calcium, the vitamin D, the phosphorus, the magnesium, vitamin K, all those tremendous, amazing foods that will support your bone health. Next, we really want to focus on exercise. So remember, the bone is a dynamic structure that responds to stress. So we want to focus in on one frequency. We want to do weight-bearing exercises anywhere between 3 to 5 times per week. And resistance training, that could be the similar things, right? So I would say the 3 to 4 is probably the sweet spot. So that resistance training or weight bearing. So what is weight bearing? That includes walking, maybe with a weighted vest. Resistance training is including things like weights, resistance bands, or body weight exercises, as long as there's some progressive overload each week on week. And I would say, if you have a history of osteoporosis or had a fragility fracture, this is a different conversation. This is really more for osteopenia and early osteoporosis, so for people who have not had a fracture. When you're looking at exercises, you should speak to your physical therapist, and especially, like I said, if you've had what we call a fragility fracture, is really get them to help you determine what is an exercise program that's safe for you in your current state of health. Outside of that, speaking to a physical trainer, especially one who understands the risk and the things that we're really looking for, progressive overload, not doing too much, I would say a physical trainer would be fine. But again, you can do that, but the type of exercise, like for biking, is not going to be great for bone health, but walking, jogging, jumping, that would be. Next is how long should you be doing that? I'd say at least 30 minutes throughout the day. But again, you could break this up into 10 3 minutes of exercise per day. Again, safety first, progress slowly, gradually, but continue to make movements. And then finally, do you need supplements? I would say check, test, don't guess, as my friend Dr. Joe Kahn would say. B12 you should be taking. If you're low in vitamin D, yes. Does K2, it can play supplementation, is not universally recommended as far as a K2, but it can help. So it's hard to measure right now. But again, I don't think it's going to be harmful. So if you take K2 with your D3, I think that's okay. It's also been shown to be beneficial for heart health. But you should be eating plenty of folate. But make sure you're taking that B12. And then what about vibration platforms? Some people, like, I've heard those can be helpful. It could be, but it doesn't take much. Small. It's not going to be harmful to do it, I think, especially if you do it in small doses. They can be expensive, but if you have a gym that has one, why not? But again, there's also some other things I just wanted to highlight that you could do before I end the video today, is you could also look at bone turnover markers. There's a few different ones. Get some baseline. These are blood tests. Some measure bone building and some measure the resorption of bone, or the bone breaking down. You can actually get your baseline, do a lifestyle intervention like the exercise, the diet, whatever. Check it again in 3 to 6 months and see if you see some improvement. So this would be something you could do more often than the DEXA scan. So I'm doing that with some of my patients, and we're really seeing some interesting results. So check that out, guys. But that is everything I have on osteoporosis for today. I hope you found that helpful. It's just such an important thing. But again, if you are a gentleman who has had low testosterone, you need to get your bone density checked. I think you're a neglected gender in this conversation. And if you're a woman, getting this bone density younger, especially if you've had any of those risk factors that I've mentioned before, is more important, because we want to make interventions before we have a fracture, not after. This conversation blows my mind that we're not having it more often and earlier in particularly a woman's perimenopausal journey. Yeah, so there it is, guys. I hope you found that helpful. It was awesome to talk to you guys. And yeah, so looking forward to it. Someone's asking, when should you get bone density? I think I just mentioned, are there other options other than DEXA scans? I think the DEXA scan is the gold standard. And yeah, so okay, guys. Hope that's helpful and really appreciate you. This goes live and the recording is absolutely available on YouTube. If you're on Instagram, you could go check it over. It'll be available immediately as soon as I end here. So thanks, everyone. It was great having you. As always, I'm sending gratitude, joy, peace, and love your way, and healing, because we need more of that in this world and in our own lives. So thanks again, and have a beautiful rest of your day and weekend.